Hello everyone, welcome to the channel. Today we'll be talking about seizures, what it means, its definition, and different types of seizure. We are familiar with the word seizure because it's related with, it comes up with epilepsy, which is the fourth common neurologic disorder, and about 50 million people worldwide have epilepsy. And epilepsy is known with recurrent seizures, so we should really know what seizure means. So seizure can be defined as a sudden and brief disruption in the normal electrical activity of the brain, or it is the excessive electric discharge in a group of brain cells or neurons. So when we look into the clinical presentation, it actually depends on where in the brain the electrical discharges, this electric storm is. So it actually ranges from rapid blinking to falling to sudden fall for apparently no reason. So generally the clinical presentation includes rapid blinking or chewing at inappropriate times, staring at nothing fixedly or at something particular, loss of consciousness, falling for apparently for no reason, and muscle jerks. So when we come to the diagnostic workup, we start with the most elemental, basic, and important part, which is the history and physical. So we should look for risk factors, which include physical infection, metabolic disturbance, hormonal change, drug or alcohol use, trauma, family history. We should also look for if there is missed medication, stress or anxiety, dehydration, and also extreme fatigue or lack of sleep too. So the next diagnostic part goes to labs. So when we look into the laboratory thing, we consider the lab panel and the lumbar puncture, which are crucial. The neurological exam, such as we also take the neuroimaging, which are electroencephalograph and MRI as well. So EEG, when we look at the EEG, we look at whether it returns to the baseline. Okay. Here you can see the spikes in the EEG of a patient with seizure, and as compared to a human being, a patient without a seizure, this has a lot of spike. So the two major categories of seizure are the partial onset seizure and the generalized seizure. We will look into each classification. So partial onset seizure is also known as focal seizure. It is when one area of the brain is affected, and it originates from the focal area of the cerebral cortex, and it may spread to other cortical regions. It's either bilaterally or unilaterally. It may manifest with motor signs, autonomic symptoms, somosensory or special sensory symptoms, and as well as psychic symptoms. So the first subclass of partial onset seizure is simple partial seizure. It do not impair consciousness. Consciousness is usually preserved, and it can cause twitching or a sense of an odor or taste that's not actually there. And the focal motor seizures can originate the precentral gyrus or spread to the precentral gyrus from neighboring cortical regions. It can have autonomic symptoms. And these autonomic symptoms include such as vomiting, sweating, piloerection, pupil dilation, inconsistency, and such. Simple partial seizure with somatosensory symptoms include it actually originates from the postcentral gyrus and may include feelings of focal paresthesia like pins and needles kind of feeling, numbness, warmth, or electric shock like sensations. The secondary sensory seizures include symptoms such as a feeling of cold, pain, or the desire to move. It actually is characterized by more widespread movement of sensation from the contralateral, ipsilateral, and bilateral sensations. So, and sensory seizures can also originate from supplementary sensory areas and also from insular cortex. If it's from the former, it involves tingling, desire to move, stiffness, pulsing, pulling, and heaviness. But if it's from the latter, which is the insular cortex, it involves the nasal or pharyngeal, which gives them a sense of strangulation. Special sensory seizures include visual, auditory, gustatory, olfactory, vertiginous symptoms as well. So the visual seizures can originate from primary visual cortex, and it consists of primary visual hallucinations such as flashing lights, spots, stars, or circles of color light. And complex visual hallucinations originate from visual association cortex and can actually include seeing people or a person or scenes. Auditory seizure can originate from the lateral temporal region, and it includes clinical symptoms such as buzzing, ringing, hearing rushing sounds, hyperacusis or hypoacusis, sound distortion, or hearing words or music. And when we come to olfactory seizure, it actually originates from the uncinate gyrus or the mesial temporal region, and it's actually characterized by, usually described as, involving smelling unpleasant odors such as burning rubber, smoking, or sulfur. The gustatory sensation, or originating from temporal lobe, insular, or ventral operculum, is described as a metallic taste, but can also be either bitter or sweet. The vertiginous symptoms originate from the lateral temporal region. So simple partial seizures with psychic symptoms indicate disturbance of higher cortical function. For example, dysphasic symptoms include expressive or receptive language disturbance and may involve repetition of a word or phrase. Other cognitive disturbances, such as dreamy state, distorted time sense, or derealization, or a sense of unreality, may also be present. Emotional symptoms can include pleasure, fear, anger, which occurs in paroxysmal, lasting seconds to minutes. So when we come to the second type of partial onset seizure, which is complex partial seizure, it includes impairment of the consciousness. So a person may appear dazed or confused, and it's usually they're usually unable to respond to others for a few minutes. Clinical features depend on regions affected by the abnormal electrical activity, and it's usually originate from the frontal or temporal lobes, but it can occur in the parietal or occipital lobes as well. The third classification is secondarily a generalized partial onset. It occurs when a partial onset spreads to both sides of the brain, to both areas of the brain. So the second type of seizure is the generalized seizure. So the first classification of generalized seizure is absence seizure. It is characterized by a sudden onset behavioral arrest, a blank stare, unresponsiveness, and brief upward rotation of the eyes. Duration typically lasts for a few seconds to half a minute, and a patient typically resumes the activity he or she was doing prior to the seizure. The International League Against Epilepsy in 1981 has recognized 5 subtypes of absence seizure, which include absence with impairment of consciousness only, mild clonic competent, atonic competent, tonic competent, or automatism. So the tonic-clonic seizure, it's also known as a grand mal seizure, and it's characterized by abrupt loss of consciousness followed by tonic contraction of muscles. Mouth is forcibly closed, which can result in tongue bite. Pupils become dilated and the eyes deviate upwards. The upper extremities often symmetrically abduct flex at the elbows, while the lower extremities may briefly flex and then extend and then adduct with the toes pointed. Clonic activity then follows, which is initially rapid and then slows. Since the respiratory muscles are involved in the clonic activity, gasping respiration can occur. Patients may become cyanotic as a result. Urinary inconsistency may occur. At the end of the seizure, the patient is unconscious for a brief period of time and then gradually recovers. Patients typically report generalized muscle soreness and sometimes headache post-ictally or post-seizure. So the third subclassification of generalized seizure is the myoclonic seizure, which is characterized by a brief, irregular shock-like jerks of the head, trunk, or limbs. It can be symmetrical or asymmetric and involve the whole body, regions of the body, or focal areas. It tends to occur close to sleep onset or upon awakening from sleep. And it can be a feature of some idiopathic generalized epilepsies, myoclonic static epilepsy, Lafora disease, and infantile spasms. So the fourth class of generalized seizure is the tonic seizure, which involves tonic contraction of the face, neck, axial, or pendicular musculature, which lasts from 10 seconds to a minute. It involves extension or flexion of muscles and often leads to falls and head injuries. It involves only upward eye deviation. And it usually occurs out of the non-REM sleep, that is the non-rapid eye movement sleep. And it's usually seen in patients with symptomatic generalized epilepsy, common seizure type in patients with Lennox-Gastaut syndrome, and it's also occur in epilepsy with myoclonic static seizures. So moving to the fifth class of the generalized seizure, which is the clonic seizure. It is characterized by repetitive arrhythmic clonic jerks with impairment of consciousness and short post-ictal phase. It can lead to clonic, tonic-clonic seizures, and it's thought that the repetitive discharges are due to the rhythmic excitatory discharges from the cortex. So the sixth class of the generalized seizure are the atonic seizures, which are characterized by sudden loss of mass and tone, which could lead to a head drop, a limb drop, or a drop of a whole body, as you can see in the picture. It's a brief loss of consciousness and injuries, and particularly to the face may occur. It may last less than 5 seconds in minimal post-ictal or post-seizure confusion. It may be preceded by a brief myoclonic jerk or tonic component, and it's usually seen in the symptomatic generalized epilepsies such as the Lennox-Gastaut syndrome. This we have also mentioned that this syndrome can also be seen with in atonic seizures. It's actually a childhood onset epilepsy, which is so severe and characterized with recurring seizure. So this is all for today. This is just a brief introduction to seizure and its types. Thank you for watching. See you next time.